sure that's the right one.
You're right, Carly.
Oh, I'm having some nightmares with technology.
Oh, you're not really? Oh, I'm sorry.
Really, yeah, nothing's working with my Mac.
Oh no! Were you one of the Mac victims?
Have you had that before with these
never.
things? Is this? That's bizarre.
Never had that before. Yeah, no. So, yeah, gonna have to look into that. Whether it's just something new or whether they've put in a new feature or had another squabble with Microsoft. I don't know, but yeah, it's been a bit of an issue.
Can you not get into rooms then, or?
No. And my camera doesn't work in the main room. So yeah, it's just been a bit of a headache, but fortunately here, which has kind of alleviated some of that worry.
Yeah, no, I'm very glad you're here.
Right.
No, Brian, we probably just cancelled the session if Carly hadn't been here. Given my slides, I would
manage your way through it. I'm sure you could.
I wouldn't make anybody listen to what I'm going to say. So.
Oh dear, but it's going well, I think. So,
yeah,
gosh,
yeah,
Lily, wow.
Yeah, I don't like crying at work. I'm glad I'm in a room.
Absolutely. I need to bring her on board with the school. Definitely.
So what time did we say we'd give it till? About 40. Give it a couple more minutes.
And how long we got, Brian?
Well, we've been reduced slightly, so I'll just double check what the latest is. I'll
be with you in a second, Brian.
Okay, Brian. 3:10 we've got until.
Oh.
So yeah, was it an hour? Is now half an hour?
That's very, very sorry. Yeah, it's because we've got Sally coming in from Department of Health and Social Care, leads on long-term plans. We're just a bit aware that we've run over. It might affect her diary, so we're just really keen to, if we could, and I'm very, very sorry, keep this till for about 30 minutes, if that's all right, Brian.
Yeah, is that okay?
Fine. Well, let's get moving then.
Okay.
People will join as they come back from getting their tea.
They will do, yeah. I'll just try and get your slides up while we're talking. Okay, we are having a few technical issues at NHS today, so unfortunately.
Well, I'll start while you're getting started. So
yes, please.
So this afternoon's workshop Very pleased. I feel a bit of a fraud sort of facilitating chairing this because of the people that are speaking, but anyway, we will move on from there. We've got Campbell and Carly talking about some work they've been doing around supporting carers in primary care. That been work they've been doing up in the northeastern Yorkshire and wherever you're based, Carly, which I can never remember.
North Lincolnshire.
That's right, yeah. So, as with all the other sessions, the usual stuff in terms of housekeeping, it is being recorded. So if you're happy, that's fine. If you don't want to be on the recording, obviously turn your videos off. We will try and get some time for some discussion, looking at Campbell and Carly, but maybe the people just put their hands up during the talk if there's anything that anything in particular you'd like to flag. And I think without further ado, we'll get started because I'm aware that we are struggling for time. So Campbell and Carly, I'll pass over to you to introduce yourself and get going.
Are we going to have the slides up?
I'm just working on those at the moment, Carly.
Okay.
We seem to have a few beautiful technical problems.
I might be able to do my side. So if you just start introducing yourselves and I'll see if I can get them this side.
Okay. Well, good afternoon, everyone. My name's Carly Sales, and I have been a sandwich carer, but I am currently a parent carer, or as I prefer to refer to it, as a forever carer. And Campbell?
Hello, my name is Campbell, and I'm an experienced care lead working in the North Eastern Yorkshire region of NHS England.
Super. So thank you everybody for attending. We're here to talk to you today about improving support for carers in primary care. So what's the purpose of today? So whilst Campbell is going to take you through some of the context of the work that we have done to support carers in primary care, I will tell you about how I became involved and the work undertaken and some of the results that we are seeing locally here in North Lincolnshire. So whilst we are speaking, please can you introduce yourselves in the chat box and just tell us a little bit about your experiences of primary care in your area. So without further ado, I will now hand over to Campbell. Thank you.
Thank you, Carly. Next slide, please, Jim. And next slide, please. So we are going to, and if you could click again, Jim, there's another animation on that slide. What we're going to do over the next, it feels that time's getting smaller and smaller, is we are going to look at the development of practitioners' guides to carer support. The bulk of the work, though, is going to be with Carly, who's going to talk about the development of work in North Lincolnshire. And what I'm going to do, though, is just really quickly give you some context about it. So I'm going to look at the impact that caring has on carers and why support should be given to teams working to support this population in primary care. Next slide, please. And then next slide. I'm going to look at the economic and the population health evidence for supporting carers, and then I'm going to look at some of the national guidance that's available to support the development of tools to support work teams within primary care to better identify, support, and then signpost unpaid carers. Over the past couple of years, I've had the pleasure of supporting teams in our region, the North Eastern Yorkshire, to develop practitioners' guides to carer support. And I'm going to set out briefly why it was done and the frameworks that we built them from. But first, who is considered a carer? This is a general definition taken from the NHS England website, and it's the definition roughly of a carer from the Care Act. I won't read it out. The important element of this definition for what we're going to talk about today is the last few words. That is that the care they give is unpaid. Paid care work is out of scope for our presentation today. I'm always nervous about using this slide, as one of the big issues that we have in the carers world is how do you define a carer? But after a few years now working in this agenda, I believe that it's really important that everyone is asked the question, do you provide support to someone who could not cope without that support? But the answer is always personal. The vast majority of the people we'd like to reach to make them aware of the offer would not identify themselves as a carer. Instead, they are mother, father, daughter, brother, etc. But without being recognised as a carer, the offer, such as the packs we're going to talk about today, would not be available for them. It's this argument of the personalisation approach. We have to treat individuals as individuals. Next slide, please, Jim. The first thing I want to talk about, again, briefly, is the economic argument. We've heard the unpaid carers dashboard referenced a couple of times, and I'm aware that they are at the conference today, but I'm really keen that everybody gets a look at this. I should say that what I'm going to do when Carly's talking is I'm going to start posting lots of links to lots of information we're going to talk about today. So the unpaid carers dashboard, in a nutshell, allows you to explore the census data and create charts, graphs and reports so that you can see which groups of people are providing unpaid care within local authorities. And you can then compare that with other places in England and Wales. And headlines for the dashboard that are on the slide include the fact that 4.3 million people in the UK become carers, and that in the UK, unpaid carers save the public purse £184 billion a year. And it's that element that we want to focus on. This is part of the reason why we need to develop support for carers within primary care. Next slide, please. The next thing we want to look at is the health argument. So this is the information taken from the GP patient survey. So the GP patient survey is an annual England-wide survey that gathers feedback from patients about their experiences with GP practices. One of the demographics question relates to unpaid carer status, and from that we can cut the data from the survey to this population. These cuts are available at ICB level, and they're available on the public website. So again, I'll post a link where you can find that for your area. Always caveats about survey, and I should note that not everyone in a GP practice will receive the survey, not everyone will fill the survey out, but given the gold standard framework that we've got with regards to this survey, I think it gives us an opening into the health impact on carers. Next slide, please, Jim. So just going to flash through this one for the sake of time, but this is an overview and it gives you an example of the information that you can get from the ICB level work at the GP patient survey. You'll see, again, this has been mentioned earlier with regards carers being over that age of 55 and the numbers of carers actually providing care for 50 hours and more a week. Next slide, please, Jim. And this one is with regards to health. This is one of the main reasons why this work is happening at the moment. You'll see 73% of carers in Humber and North Yorkshire, again, 63% of the general population, the blue, if you like, are reporting long-term health conditions. More carers are reporting feeling sense of isolation. More carers are reporting mental health conditions. And although 33% of the people that responded to the survey said they felt supported, only 27% of carers did that. So again, this is the health argument as to why we need to provide this support. Next slide, please. Now I'm going to look at some frameworks. We know why we want to do the work. How do we go about building the work to support unpaid carers? I don't know if you're aware of this, and again, I'll put a link in the chat box, but it's a new resource for health and social care professionals from the VCSE Alliance. It's available on the Carers UK website and the Carers Trust website. And what the pack does is it expertly put together the requirements for an integrated approach to supporting carers, and it really usefully summarises the legislative requirements on the system, support carers, the legal responsibilities of the system, and also a whole heap of resources that you can use. Next slide, please. If you are looking at developing a pack in a nutshell, you don't need to start with a blank page. And another great piece of support that would be available to you, and was one of the main features that we used developing the practitioner's guide throughout the region, was the QS200 the QS200 quality guidance that's published by NICE. Again, I'll put the link in. You'll see the quality statements there in the left-hand column, identifying carers, working with carers. And what's here, freely available, is information as to how you can do that, really practical steps. Next slide, please. And what we must never forget, and although developed in 2019 and currently under review by some of the people that are moving the slides along. Sorry, Jim, next slide, please. Or unless you don't want to go into the one with regards to framework. And although developed in 2019 and still under review, so keep an eye out for the new version, the Supporting Carers in General Practice Framework of Quality Markers provides a series of practical ideas that have been developed in partnership with carers and primary care teams. And what, I won't go through it again in detail, but again, the idea here is there's no blank page. These quality markers will provide you with the guidance that you require when talking to, as you're talking to your local population, about how you can go about developing a practitioner's guide to care or support. And what I'd now like to do is to hand over to Carly, who's going to talk about an exemplar of what that support can look like. Carly.
Hi. I guess to really understand how and why I became involved in the work that Campbell started, you probably need to understand a little bit about my story. So I'm an adopter. On February the 14th, that's Valentine's Day 2014. Sorry, Jim, can we have the next slide, please? We, as in myself and my husband, decided to look at adoption. And on fireworks night, 5th of November 2014, that's just short of 9 months, we welcomed Emmy and Ted home. And I have to say that the fireworks have not stopped. I still remember the social worker's words ringing in my ears. Oh, they'll be fine, those two, but they aren't fine. They weren't fine, and they were never going to be fine. Every few years, we receive another diagnosis. They have learning disabilities, fetal alcohol, autism, global development delay, genetic conditions, attachment disorder, and other problems relating to early years neglect and trauma. As the highest earner, after 6 months, I went back to work, and my husband took a year's adoption leave. But in 2016, and due to the clearly very complex needs of the children and absolute utter exhaustion, my husband had a breakdown and went missing. I had 2 police forces looking for him. Life changed, as you can probably imagine, overnight. I had to take a break from work as I had to look after not only my children, but also my husband. And just a few months later, my dad was diagnosed with a complex medical condition called Lewy body dementia. Aside from the logistics of one person looking after 4 people, I also went through a period of grieving. As the complexity of the children's conditions became more apparent, I grieved for the future that I thought that they were going to have. I grieved for the rock of support that my husband had once provided. And as my dad slowly disappeared, I grieved for the loss of him. I had no one to lean on. Thrown into the mix, I was sacked due to my caring responsibilities affecting my work, thereby losing the career that I had loved and nurtured for 20 years. Ultimately, myself and my husband faced the prospect of bankruptcy. We were deserted by all those friends and family who promised that they would be there, and we were told by the children's social workers that there was nothing they could do. Eventually, when you hit rock bottom, you have no choice. Either you can let a situation finish you, or you can make a change. So we packed up everything, including 2 dogs and a cat, and we moved back to Lincolnshire. It was like starting again from the beginning, trying to get the children's health records and services transferred over from London was just awful. It was as if we weren't believed, as if we were living in an entirely different planet, let alone just a different county. We had to start again with all the referrals for assessment. The fight to get services to listen to us was exhausting. It almost broke me. It was as if I was making it all up. Sadly, my dad died in 2023, but Matt recovered well and is back to being a rock of support. And I've worked hard and alongside many, many amazing individuals across education, across the health system, and across social care to get my children into the right schools and create the right support system for myself and my family. Can you change slides, please? So it's time for me to make a difference. We know that we need to plan for me and Ted's future. We're lifelong carers. Or as I like to say and have said, we're forever carers. The amazing help and support that we've had from so many working across health, social care and education systems means that they are now happy, and they are achieving great things that we once never thought possible. Part of me is putting myself back together, and as well as completing a postgrad in psychology, I've also become an NHS peer leader, and my as well as chair of the North Lincolnshire Carers in Partnership, and I'm just about to open a new school. So next slide, please. So why do I give up my time to make services better? Well, in this area, we've got 15,430 carers listed at the last census. That's a saving of almost 1 billion to the social care economy, and represents about 10% of the local population. As Satnam and Fatima and now Campbell have just alluded to, the carers save an estimated 184 billion per year. That's around the same as another NHS. Carers are a mix, complete mix, carers of adults, carers of disabled children and young carers. In fact, anyone can be a carer at any point in their lives. Identifying unpaid carers is incredibly challenging, as many do not see themselves as carers. Carers are seldom heard and are often hidden, which means that they can often hit crisis before services are even aware that they exist. This places a huge financial burden on local services. But we must start to put money into prevention. Preventing carer crisis before it happens is the solution. Carers remain one of the most disadvantaged, socially excluded groups in society. Caring can significantly impact on our health, family, social life, work, and financial security. Between 27 to 31% of unpaid carers have bad or very bad mental health. That's according to the Carer Survey 2023. 40% of carers are in debt, and 60% of unpaid carers in the UK report having long-term health conditions or a disability. Next slide, please. So I joined Carers in Partnership, North Lincolnshire, after moving to North Lincolnshire in 2022. I was originally a member. We worked in co-production across health, education and social care, looking at services that were there, built for carers and those that we care for, and with the aim of making improvements. We work in co-production, and we utilise the 6 C's, we call it. So commitment, connection, confidence, common purpose, and co-production and continuous improvement in the way that we work. Next slide, please. The reason the group works is because we all have a sense of common purpose. Many, if not all, of the professionals and our partners have also been carers at one point in their lives. Next slide, please. And I think we're behind one. Can we go along another one, please? So our work so far. In October 2022, Carers in Partnership was approached by Campbell to develop a regional resource pack for health practitioners to better support carers in primary care. A pack originally developed, I think it was in Sheffield, but please don't hold me to it, was offered as an example, and we were briefed as to how we could regionalise the content. Carers in Partnership developed a working group alongside Teresa Bainbridge, who is the North Lincolnshire Local Authority Adult Services and Carers Principal Lead, taking the helm alongside other partners, including Carer Support Services, NLAG, Citizens Advice, Humber and North Yorkshire ICB. Next slide, please. So one of the first jobs was to reduce the content. The original pack, I believe, was around 30 pages. So we focused on condensing this into a more manageable 11 pages. I was responsible for editing and rewriting some of the copy, ensuring that any healthcare personnel will be able to pick it up easily and read it and digest the contents of the pack. My husband is an amazing designer, and he did the design side of things for us. So we took a lead in designing the pack as well. As the pack evolved, we collectively agreed that it was more like a guide than a resource pack. So the North Lincolnshire Guide to Supporting Carers in Primary Care was born. We included a carers charter as part of the guide, something that we aim with local ICB support to ask all GP practices in North Lincolnshire to sign up to. We knew that we wanted to pilot the guide, and I had have a really great relationship with my GP surgery, and they agreed to work with us to support a pilot. Next slide, please. So I made the initial introductions to the practice, and Teresa Bainbridge coordinated an initial meeting, inviting one of the surgery group's practice managers, Sherry Handley. Sherry had experience of being an unpaid carer for her grandmother, and so immediately saw the value of the guide. We discussed how the pack could be used by clinicians as well as practice staff, and she agreed to go away and have a think as to how the guide could work. Jane Goulding, practice group lead, joined our second meeting and had, amazingly, a full implementation plan and pilot rollout already planned. We agreed to do a presentation of the guide to all practice staff and decided that the guide could be piloted in 2 surgeries, Riverside and Trent View. Jane had developed a plan to increase carer identification by asking patients during annual well-being checks if they are unpaid carers. Those who positively indicated caring responsibilities were offered a carer's need assessment as well as blood pressure checks. They could also be signposted to carer support services and other support services, including mental health services. We designed waiting room posters, web banners, patient leaflets, etc., to be implemented across the practices. And in July 2024, we presented the guide to practice staff as well as clinical representatives from the practice group. We were introduced to Yvonne, who was going to head up the proactive calls to carers. And going forward, we will meet the practice managers on a regular basis to review impact. Next slide, please. So here we get to the important part, which is the impact so far. So although we're still running the pilot, initial signs are that the guide has been received really positively by both unpaid carers and practice staff. Supporting communications such as waiting room posters, web banners and patient leaflets have been written and designed by Matt and myself and implemented by the practices. Trent View originally had 188 unpaid carers SNOMED coded, but now has 833. Riverside's uptake for blood pressure checks for carers, for unpaid carers, has been just over half at 51%. There has been a significant uplift in signposting to local carer support services for assessment, increasing by 37% as opposed to this time last year. The practice group is looking to roll out the guide to 4 of its other practices, and we will work with them to support that. Next slide, please. So the future. We're not stopping here, we have ambition. Our secondary care colleagues have asked us to adapt the guide for secondary care, including the creation of ward mission statement. This is currently at the approval stages. Plans are in place to have the guide published on a website hosted by Humber and North Yorkshire ICS. We have adapted and templated the guide, so it is now in the process of being available as part of NICE guidelines, and we are working with our ICB colleagues to make all GPs in North Lincolnshire aware of its existence. We have adapted it for social workers at North Lincolnshire Council. And finally, we also want to roll out the pack to other health partners, including dentists and ophthalmic practitioners. It's hoped that moving to a preventative, proactive model will reduce financial burden of carers in crisis, as well as ultimately helping to save lives. And I will hand you back over to Campbell to conclude. Thank you very much.
Thank you, Carly. I'm aware we've got 5 minutes, Brian. So what I'm going to do is there are other packs available across the region, and I should really mention them. And I want to give a particular shout out to Sue Lee, who's I believe is on the call. Sue's currently developing a pack, has developed a pack and is doing an amazing piece of work in South Tees. The packs also exist in North Tyneside. The West Yorkshire one's just been published. They're available at every place in South Yorkshire. York's got one, Northumberland's got one. And the reason we're doing it is because of that last slide that Carly shared with regards to impact. What we're doing is we are, through these packs, better identifying carers, and as a result of that, they're getting better support. And then what we're able to do then is signpost appropriately, and then we'll move on. We could literally talk for another 30 minutes with regards to secondary care work, because what we're doing is using the principles with regards to this work, nicking it from the London discharge toolkit, using our primary care principles to create similar sort of processes. And again, I'll just post all the links in the chat box. And that's us, because I think it'd be good to have a few minutes to have sort of proper questions.
Yeah, absolutely. Yeah,
and thank you, Carly. I think maybe final word to Carly.
I was going to say thanks to both, but in particular Carly for sharing such a powerful and what must have been a very, incredibly stressful period of time. But the fact you've been empowered by those experiences to do what you do now is incredible. And we're very lucky because people won't know that Carly's actually been one of the key people shaping this whole conference. She's got various strings to her bow. So thank you, Carly. Yeah, any kind of questions or points that people want to raise? Susie.
Hi, Brian. Thank you. Carly, thank you so much for that. Really informative and really helpful. I'm from Devon Carers at West Bank down in Devon. So we're commissioned by Devon ICB and also Devon County Council to provide the support for carers. I think one thing that we've all understood from across today that we knew before, but it's always good to share it in a space like this, is that actually integrated care doesn't actually work. It doesn't actually exist. Which is just, a scary, frightening thing. And as we know, it is a bit of that lottery that you could have this care in Devon, but it might look different in Manchester and it might might look different in Kent. And as providers and supporters for carers, we're actually pretty much doing the same as that. We're pretty much being a lottery around. Carly's doing this great work there. Someone else is doing something similar in a different place. We've got a carer-friendly GP program down here in Devon, and all with the best interest at heart. But it just seems that both within statutory services and within voluntary services, because of the absolute passion to do the best for carers and the passion to do the best for cared for persons, again, it's not integrated, and we're all doing something similar in different ways. And our carers then get different support that our patients get in different parts of the country. Thanks, Brian.
Yeah, absolutely.
Can I really quickly respond to that? I think that's bang on, and I think the kind of the technical expression unwarranted variation I think exists across England. And the only thing I would say is that news from Stephen Kinnock this morning was welcomed, because if we can model that kind of idea of lots of departments coming together for carers, then perhaps that might trickle down so that we can get that across the NHS in England. I think we're building on a huge amount of work, and I think we've got the passion, and we've got people like Carly driving this. And I think because of that, I think this is going to work, and we can start challenging that unwarranted variation. But it's a really good point.
Yeah, absolutely. There's a couple of good points in the chat as well. We obviously haven't got time to cover them now, but we will collect this chat. And there's definitely potential for us identifying areas that have overcome some of the challenges people have faced, like Lindsay, what you were saying about. So we'll try and link people up after the meeting. But thank you very much, both of you, and thanks all for joining. And now we shall return to the main room. So if you click leave, and then you should be able to resume on the main
Thanks, Brian.
Group. Cheers all. Bye.
Thank you. Thanks, Brian. Thanks, Carly. Thanks, Campbell.
Thank you. Bye.
Bye.